Hello, everybody. Hope everybody can hear me well. My name is Faruk Caglar, and I am the principal research scientist at Lune Startup Studio. Today, I will be presenting Federated Learning, a collaborative, privacy-preserving, decentralized approach to artificial intelligence. As you might know, we have to centralize the data to train our AI algorithms. And in the case that we have the distributed data, and then you are unable to centralize your data, how would you train your AI algorithms if you have such a case? There is no way for you to centralize your data, but you need to train your AI algorithm. There are many cases for these kind of situations where the data is sensitive for organizations and institutions. So in such a case, it is a challenging process to train the AI models. So therefore, today I will be presenting this the solution for this problem, and it is named Federated Learning to train the decentralized data. And I will also share our experimental results on the breast invasive carcinoma model that we have tested during our SEDAI process. Let's get started. Here is the agenda that's waiting for us today. We will get started with the introduction and then artificial intelligence in healthcare domain. Then we will be discussing about the AI challenges in healthcare domain and what's the solution approach for the challenges in the AI domain, and then federated learning and our experimental results that we have tested in SEDAI process, and it was for the breast invasive carcinoma model. And I will conclude my presentation. Let's get started with the introduction. Artificial intelligence is transforming every aspect of the life. And I believe everybody is using the ChatGPT and many AI technologies in our day-to-day life. From education domain to finance to manufacturing and all the way to the healthcare domain, it's everywhere in our life. And especially in the healthcare domain, the data is increasing at the exponential rate. Let's think about the healthcare records, radiology reports, pathology data. Think about all X-rays and MR images, CT scans. All these data is promising to create efficient AI models if the data is accessible easily. However, in the case that you cannot access the data, it's not going to be possible to create the AI models that will save the lives. Therefore, once we have this data in the scientific literature, we have been seeing a lot of publications that the AI can assist us to resolve the healthcare challenges. From dermatology domain to oncology domain, aesthetic domain, and radiology domain. For example, in the dermatology domain, lesion identification and malignancy prediction from clinical dermatological images is one of the examples in the literature. And self-supervised learning in medicine and healthcare in radiology domain is another example for the AI assistance in the healthcare domain. There are quite a lot of publications in the healthcare domain, so that these are just few examples from all those publications. So what's the requirement for an AI model? The very first step for an AI model is the data collection. So if we don't have the data, there is no way for us to train the AI model. So that means that data is food for the AI. And machine learning models are data hungry and requires good enough data sets to train. So for all of us, if we would like to train a nice performing AI model, we need to have the large and diverse set of the data sets to train our models. Without the data, it's impossible for an AI model to learn. But where we have all these data, it is not always possible to have all these data in a centralized manner. These data usually resides in a distributed locations. So, okay, in the healthcare domain, there are quite a bunch of data, and we would like to use that data to train our AI models, since our AI models requires data, and the AI models are data hungry. And now the question is, can you collect these data from hospitals and institutions? There are some issues if you would like to collect some data from hospitals. Some of you may have already heard, and if you have some data in the hospitals, you can just think about by yourself whether or not you would like your data to be used for any purposes, because it's your data, right? So one issue to collect the data from hospitals is privacy concerns. Healthcare data, in particular, is highly sensitive, and the patient privacy and data protection is a critical concern of many governments and many countries. And there are some strict privacy laws to protect the personal data. And in Europe, the General Data Protection Regulation, GDPR law, and in United States, Health Insurance Portability and Accountability Act, HIPAA law, and in Saudi Arabia, the PDPL law restricts us to use the data for the AI models, or has some restrictions to use that data. So that's the first thing, the privacy concerns. The second one is the organizational policies. If you think about an organization or a company, they might have some strict policies to limit the data sharing. And another concern is organizations might reluctant to share their data. Hospitals, researchers, and institutions, they might be reluctant to share their data because of the competition of the publications and some business concerns, all these kind of reasons. Okay, in the case that there is no privacy concerns, there is no organizational policies, there is no reluctance to share the data, in such a case, you can share your data, the distributed data, between the organizations. But there could be another problem. If the volume of the data is quite big, it's also a challenging process to centralize those data and train your AI model, because it will require sufficient computing power once you centralize the data. And once you have a big chunk of the data, gigabytes of terabytes of data that you have to centralize, it's usually a big challenge to centralize all that data from different locations. So the question is, how would you resolve a healthcare challenges and save lives without sharing patients' data residing in the hospitals? So the solution approach for this problem is, and the focus of today's presentation is, federated learning. In the federated learning approach, you don't have to centralize the data. The data will reside on the end clients. If it is in hospitals, it will stay in hospitals. If it is banks, it will stay in the banks. And the data will never leave the boundaries of the hospitals, organizations, banks, whatever the institution is. And this is quite exciting, right? And the communication is SSL encrypted, and making it impossible for anyone to intercept and take the data. And it's a distributed approach, it's distributed machine learning approach, and trains the machine learning models with using the decentralized data. So what's the difference between centralized training and the federated learning? In the centralized training, what we do is, if you have 3 hospitals, hospital A, B, and C, you have to centralize all data in one place, centralize them, and train your deep learning algorithm on the centralized data. In the federated learning approach, on the other hand, we have the hospitals, hospital A, hospital B, and hospital C. The data stays in the hospitals. They never leave the boundaries of the hospitals. And you train your deep learning algorithm with the local data sets rather than centralizing them. So rather than taking data near to the algorithm, at this paradigm, you are taking your algorithm near to the data, the opposite approach. So how would the federated learning work once we think about a scenario where we have one community hospital, one research medical center, and one cancer treatment center? All these three institutions, they have the data, different types of data from the diverse set of the demographics of the people, and it is better if you can utilize all those data to train your AI algorithm. And in such a case, what would happen is data is not centralized on a single server. Rather, they are distributed in these 3 organizations, and the data remains locked on the servers of the hospitals. And what will happen is, in this scenario, we have a global AI model, as you can see in the federated server. That model, the weights of that model is transferred to all these institutions, and that is trained with the data on those, with the data resides on those hospitals with the model that's been transferred to those institutions. And once the training on those institutions are done, the model updates. I would like to emphasize this statement again. Only the model updates, the weights of the model is transferred back to the federated server, and then by utilizing some federated learning optimization algorithms, the model is updated over here on the server and then pushed back to all institutions. And this iteration continues until the model is converged or a certain number of configured federated rounds are completed. And in this case, once again, only the model updates are transferred between the server and then the institution. So that's how the federated learning works at the very high level. So in such a case, one example to have a setup for this kind of federated learning environment, there could be 3 applications involved. One is the federated learning client, one is the federated learning server, one is the admin client. And in this case, federated learning client, FL client, it's an application, server application. It's an application that resides on the hospitals or institutions that trains the model. And then another application resides in the server, and that is responsible for the coordination between the clients and aggregations of the model updates coming from the FL client. And another application that can be called as admin client to manage this FL environment and has the complete control of this experiment. So to update the models, to deploy the models, things like that one. So the common setup could be something like this one for a federated learning environment. And after discussing on the federated learning environment and then the paradigm, now I would like to share you one of our experiments that we have utilized during our SEDAE certification process, and it was for the breast invasive carcinoma model. And here, what I will be sharing with you is during this test case with the SEDAE, with our product named Aline, what we have tested is we were certified with the SEDAIA process and got the PDPL law compliance of the ELIN during this process. And we tested our application with the breast cancer study, BRCA, and with the breast invasive carcinoma model. And what we have done here, and the experiments that you will see here is, in the case that organizations utilize only their local data to train the BRCA model. Now, when I will tell the breast invasive carcinoma model as BRCA, for a BRCA model. But what would happen, what would be the performance gain if the organizations get together and collaborate with each other with this federated learning approach? What would be the model performance? Think about the BRCA, breast cancer model that will save the lives of the people. And in this clinical data, we used the data from the Cancer Genome Atlas Program, TCGA, in the United States, and then the breast cancer BRCA data. And in this data, clinical data, there were 1,066 patients, and all those patients were located in different locations in the United States, USA Northeast, USA South, USA West, USA Midwest, Europe, and Canada. And you can see the data size that were split into the train and test cases. And we have just discarded the data in the Canada because of some of the issues in the data. We have used the first 5 sites for our experiment. And the model input for this one is the tabular data with 39 features, including the age, ethnicity, tumor stage, and several other tabular data. And the model output in this case is the prediction of the survival rate using the C index, or the statistical concordance index. And we have used our tool named ELIN, and here you can see the screenshot of some of the screenshots of our product named ELIN that we used for this experiment. And the very first thing that I would like to show and spend a little bit time on this one is the performance comparison of local only data versus the FL training data. So what I mean with the local only data is there is no collaboration. Think about a hospital, site 1 in this case, and the blue one is the local only data. That means that hospital does not want to share their data for any reasons that we have discussed, and that they train the model only with the data that they have. And same for the site 2, the blue represents the local only data training. The AI model was trained only with the local data. And the gray bar represents if those 2 hospitals get together and train the AI model, BRCA model, with the data that they have by utilizing the federated learning paradigm. Still, the data will stay in their hospitals, but now the data in both hospitals will be utilized to train the AI model. So that's what it shows. In this graph, the gray bar also shows that we keep the best performing model with the data on the hospital. And the yellow shows the global model, means that in the global model, it's the generalized global model that was tested with the data from both hospitals. And that's the global model, so that once the training is completed, then you can ship it to another hospital, the hospital 3, and then that hospital 3 can use it. That's the global model. But the gray one is the model that performed best during these rounds in the FL training with the data in the, particularly with the test data in that particular site. So that shows that one. So as you can see here, I will be providing the exact percentages at the end of the presentation, but here roughly you can see that if the hospital had utilized only their data with the blue one, rather than collaborating with other institutions, the performance with the local only data was lower than the performance of the federated learning training model. If they had collaborated with each other and utilized the federated learning paradigm, they would get a better performance for the BRCA model, for the site 1 and site 2 as well. For the site 1, if they had used their local data, their performance was only around 0.8. But if they had collaborated with the other side, two sides gets together and then train the AI model, in that case, they would get a performance around 0.85. That's great. And in the case that the global model, which is the model that we keep in the federated learning server, with the weight aggregations. So in that case, the yellow model still will get a much better performance from the local only model. So this is the collaboration of two hospitals. And in this case, what we can conclude from here is, if hospital 1 and hospital 2 got together and collaborate on training an FL model, they would get much better performance. And local only data versus the FL model performed best on the local data in this case. So it is better, what we can conclude is, it is better if they get together, collaborate, and have the better BRCA model that will make huge impacts on the lives of the people. And in the second case, now, rather than two hospitals, if three hospitals got together and then train the same model in this scenario, and still we end up with the same scenario. If three hospitals got together and then train the AI model, we will see an improvement in the hospitals, as you can see with the red arrows, from local only to the collaborated federated learning server model. Same for the global model as well, with the green ones that you see. This also shows us that rather than training the AI model, BRCA model, with their only local data in the hospitals, if they get together, collaborate with each other, and train this model through the federated learning approach, they will get much better performance without sharing the data by keeping the privacy preserving in place. And another experiment that we had is, okay, we had 5 sites, in this case 4 sites, rather than 2, rather than 3, rather than 3. If 4 sites got together and trained this AI model, in this experiment as well, we see an improvement in the performance, as you can see with these arrows. And another one is, in this test case, we assumed that 5 sites, 5 hospitals got together and collaborated with each other. So in this case as well, the performance of the federated learning model that performed based on the local data was great, as opposed to the model trained with the local only data. And once we see the third bar, which is the global model, in majority of the cases, they are also performing well. But in some of the cases, as for example, for the site 4 and site 5, they might perform a little bit less. But the gain for that one is that the global model, which can run, for example, if you take that model and run in a different hospital that was not part of this collaboration, then you will also get a better performance. But that's the idea with that one, because that global model in this scenario was trained with the diverse and large data set that were coming from 5 different sites. So in this case as well, with the 5 sites, we were able to get a better performance. So to talk about these numbers, if site 1 and site 2 got together, what we can see is we see a 5% improvement in the performance of the site 1. And in the site 2, we see 15% improvement. And if 3 sites got together, for the site 1, 6%, about 13% for site 2, and 3.7% for site 3. If 4 sites got together, we see 4.4% for site 1, 20% for site 2, 0.9% for site 3, 4.17% for site 4. And if 5 institutions got together and collaborate, then we see 6.9% for site 1, 25% for site 2, 2.7% for site 3, 4.1% for site 4, and 4.26% for site 5 performance improvement. For all cases, FL training outperforms the model training with local only data. For the case of the federated learning training, that performed best against the test data of the hospitals. So these are the numeric results. So what we can conclude from here is federated learning paradigm, as we have seen in these experimental results for the BRCA model, it allows to train AI algorithms without sharing data. It preserves the customer's privacy, and the data of the customers never leaves the organizations again. Only the model updates are exchanged between the organizations. It complies with the regulations of the governments, HIPAA, GDPR, PDPL in Saudi Arabia. And it enables us to have a better and powerful AI models that will help us to train the AI models to save the lives, especially in the healthcare domain. And it's applicable in all domains where the data is sensitive. So federated learning is a solution where the privacy preserving is the top priority for the organization. And I would like to thank you all for listening to the presentation. And if you have any questions for the presentations, I will be more than happy to answer the questions. I heard about attack that tried to get the data from weights. So that's really a nice concern for this one, even though we say that the federated learning is a privacy preserving way to keep the data. You are right, Abdullah, that there are some still attackers to get the data. Even they are the weight, they try to collect some data and then reverse engineer and try to generate some data. And statistically, there are some ways to do that one. So in our PDPL process with Aline and at Loon Startup Studio with the Sedaya process, we also certified for that one and in federated learning that's applicable that the very first thing is the data between the 2 points, your federated learning server and federated learning client, it's SSL encrypted. That's the first thing. Even if you intervene the communication between those two parties, you will, in a short term, you will not be able to take the data. But let's assume that you took the data from the network, and then you were able to get some TCP packages, either from the network, even though it's SSL encrypted and not possible, it takes years to decrypt it. And if that's the case, that was the case, or you compromised the server and you were able to take the weights from the server. So the solution for this one is two ways. One is the SSL encryption between the server and clients. That's the first solution. The second solution is there are some techniques like the homomorphic encryption. So rather than sending the raw weight data to the server, you encrypt that one as well. And in the server, you aggregate those encrypted data so that even if the server got compromised, they will not be able to see the weight on the network plus on the server. So SSL plus homomorphic encryption will prevent that kind of attacks, even if they can find some ways to reverse engineer from the weight. If there is any other question, I will be happy to answer. This is a recent paradigm, and there are many real-world applications as well, especially during the COVID time. NVIDIA was able to train the AI model globally, all around the world, all the way from Japan, China, United States, Europe, from several hospitals. They were able to collect the data and train the COVID-19 data from all those places, from the emergency services, to train the oxygen needs of the patients that are coming to the emergency care. So this paradigm is getting popular because of the privacy concerns, and there are also many applications of this paradigm as well. The test that was the test that I mentioned with the COVID-19, it was with the federated learning. That's true. So think about it. Even it's quite challenging in a country to share the data. In that case, during the COVID-19, NVIDIA was able to set things up with the federated learning with all those countries involved. And you can see Japan, China, and hospitals in the United States and hospitals in Europe. So all these hospitals and all these countries were able to collaborate to train the COVID-19 model and to train the AI model that will predict the oxygen needs of the patients in the emergency care. And that was one real world case. Another one that I can mention from the Europe is with the pharmacy industry. So if you all know the pharmacy industry, it's very critical for them, the data. And in some of the cases, there are some organizations, it could be in pharmacy or it could be in the in other domains, the sharing data, even between the departments in those organizations. It could be challenging and hard for some of the organizations, especially for the chip manufacturers. The departments, even they are not sharing the data between the departments. For those kind of cases, the federated learning is really critical. And another real world example that I can tell is the Melody project in the Europe. The pharmacy companies like the Bayer and AstraZeneca and those kind of organizations, they were able to get together and train an AI model that they can produce the drugs in a short period of time. For example, rather than spending 13 years to have one drug to get into the market, they were able to train their algorithms to search, I believe, to search the drugs by collaborating with them, and then they were able to share the data through this federated learning approach, and they were able to take a drug into the market, I believe, between 1 to 2 years. So it was very helpful, and there are many real-world applications that impacts our lives, is also getting more and more popular and being applied in many domains.